Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you very much, Rachel, and good morning, everybody. I hope you're enjoying your Monday. I don't know where you are, but it's very wet where I am right now. So I hope you're staying dry and safe, and let's get on with our subject for the day. First, a little commercial. The Medicare Assistance Program, as Rachel said, we are a program that is funded by grants through the Administration for Community Living that give us money to go out and educate seniors and caregivers and their family members about Medicare-related issues. And to do this, we do partner with a number of agencies around the state to provide these services. So at the end of our presentation, I'll show you a list of those agencies so that perhaps if you're not in the metro area and would like to get in touch with one of those agencies, you can do so. But let's go ahead and get started because we've got a lot to cover today on Medicare fraud, which is a big topic these days. First, I want to make you aware, in case you didn't know, ta-da, this is Medicare Fraud Prevention Week. Medicare Fraud Prevention Week is the week in which the date, June 5th, falls. It's not always the same week every year, but it's always the week where June 5th falls. Why? Because it's 6-5 or 65. I don't know who came up with it. It wasn't my idea. So this week, this year, is Medicare Fraud Prevention Week. So hopefully you're going to see a lot of things out there, a lot of commercials, a lot of things reminding you about the critical role that seniors play in fighting the fraud issue. $60 billion is lost annually due to fraud, errors, and abuse. And the only way we're going to catch this issue is if the people who are receiving the Medicare summary notice and the EOBs and things like that can report those issues. A lot of the money that's lost is due to honest mistakes. Those need to be reported as well so that they can be corrected. If they don't get reported, they don't get corrected. Also wanted to tell you about another thing that's going to be going on here in Oklahoma. That is our annual Fraud Prevention Conference. We've started these. We held them at Metro Tech. This year, they're going to be held on the dates of July 12th, July 19th, and July 26th. On the 12th, we'll be talking about protecting your online identity. More and more people are doing things online and on their computer. And it's very critical that you know what you need to do to protect yourself and to protect your identity and not fall for scams online. On July 19th, we'll be talking about banking and financial fraud. And we'll have representatives from different organizations who can educate you on the things that you need to be doing to protect your money. Then on day 3, which is July 26th, that's when I'll be talking about healthcare fraud, and we'll have some other speakers too to talk about that and exploitation. We really hope that you'll come out and join us for these events. You can register by scanning the QR code on the screen, or you can call 405-713-1086 to register for this event. I also want to mention, if you're somewhere around the state of Oklahoma and you might know of some entity that would be interested in hosting a viewing site, a place where people could actually gather remotely and video conference in the event, we would love to hear about that, because we'd like to partner with you to provide this information in your local community. So please, you can reach out to me, or you can call that same phone number if you know someone that might be interested. So let's get into our topic now. First, I want to touch base on the role that our Senior Medicare Patrol program here in Oklahoma has played in terms of referred cases to the Office of the Inspector General. The Office of the Inspector General at Health and Human Services is the entity that actually investigates these cases. When people call us at the Senior Medicare Patrol, we get the information and then we submit it to the Administration for Community Living in Washington. They document this information, but for those cases where we have enough information that they can actually be referred on, those go to the OIG so that they can become part of other investigations and hopefully be used to actually catch these bad guys. So if you look here, you see for each year the number of our cases that actually got referred on to the Office of the Inspector General. Now you'll see a spike there in 2019. Wonder what was happening then. That's when the COVID-19 stuff was going hot and heavy. And of course, unfortunately, the bad guys jumped on that very quickly to see how many scams they could pull at that time. Look at the huge jump in 2023, 190 cases just here in Oklahoma that were referred to the Office of the Inspector General. So what was going on? So if we break that down, 118 of those cases were related to COVID-19 test kits only. We had a number of people that were calling us, and they were saying that they had received a shipment of COVID-19 test kits that they never requested, or in some cases, people were saying that they saw charges on their Medicare summary notice for test kits that they never received. So 118 of those cases were for those test kits. 41 cases were for COVID-19 test kits and urinary catheters, and we're going to talk more about that here in just a second. 29 cases were for urinary catheters only, calls where people were calling us and saying, I'm seeing charges for urinary catheters and I don't use urinary catheters. 6 cases were for COVID-19 test kits and glucose monitors, or supplies used with those glucose monitors. Oops, I think I went the wrong direction. I did. All right. Now, so far in 2024, what are we seeing? We've got 10 that were referred on just simply for urinary catheters only. We had 8 that were for COVID-19 test kits and urinary catheters, 3 for DME items, 2 for COVID-19 test kits only, 2 genetic testing scams, and that's a little makes me nervous, because that's the bulk of what we were dealing with before the pandemic were genetic testing scams. So hopefully we're not going to see a big jump in those again. And then 1 for drug injection and infusion. So what's happening? What are we seeing right now? Well, the Washington Post back in February did an article on the urinary catheter situation. And this is what they were seeing. There were claims that were submitted by 7 companies that had all been recently sold to new entities. And over a 2-year period, the companies involved had collectively gone from billing 14 patients for catheters to nearly 406,000 patients. In 2022, 2 of those companies had started billing Medicare for $109 million for catheters for 12,000 patients. By 2023, that number had jumped to $1.9 billion for nearly 406,000 patients. So why did they choose urinary catheters for committing this scam? For one thing, they're a relatively low-cost item. The average cost for a urinary catheter is about $7. These items are used once. So where you're talking about, some other durable medical equipment or prosthetic, orthotic, or supply, they're used multiple times. These are used once and then thrown away. They're required multiple times daily. The last big scam we saw was the COVID-19 test kits, and those are used once, and you may not use another one for another month, 2 months, 3 months, whatever. But urinary catheters, they have to catheterize more than once a day at least. So they're going to be used multiple times. And it's a fairly common item that you see for Medicare beneficiaries, whether that's because they're seniors or because they're someone on disability. So it kind of helps them get in under the radar with the folks at Medicare. Now, that's talking about urinary catheters, but I want to remind you, healthcare fraud can happen anywhere, whether that's with your prescriptions, whether that's ambulance, whether that's at the physician's office. And the thing to keep in mind as well is sometimes the issue is with one of these providers, whether that's pharmacy therapy, a DME provider, whatever. The other thing is frequently it's someone impersonating one of these entities. It's someone who's submitted a bill as if they're a pharmacy or a physician's office or a hospital or something. So that's why it's so critical that all Medicare beneficiaries or whoever's assisting them by watching their bills is being very diligent about watching and making sure that the information on their Medicare summary notice is accurate. So don't get scared. Don't lose it because you think, oh no, we're not going to be able to get ahead of this and we're all going to be victims. You have the control. Let's go through some scenarios here and think about things that you've been doing your whole life. Ever since you've been an adult, there's things that you just knew weren't going to be true. All right. Here's the first one. Someone calls and offers you to sell you beachfront property in Hawaii for $500. What are you going to do? You're going to hang up. You know you're not going to get beachfront property in Hawaii for $500. Okay, let's say someone calls and claims to be from Medicare, and they need your Medicare number so they can send you a new plastic Medicare card. What are you going to do? You're going to hang up. It's a scam. If someone's calling you from Medicare, they've already got your Medicare number. So just apply the same rules and the same protocols that you apply to everyday life, and you're going to be okay. Here's another one. You call to inquire about a car ad that you saw on television, and the salesman starts asking you a lot of questions, including your bank account number. What do? You're probably going to tell them that you're just inquiring and you'll get back in touch with them if you decide you want to move forward. You're not going to give them your bank account number. Okay, so let's say that you call and inquire about a health insurance product that you saw on television, and the telemarketer starts asking for information, including your Medicare number. What are you going to do? Tell them that you're inquiring. You're not necessarily interested in signing up for their product. You just wanted more information, and that you'll speak to a local agent if you decide you want to move forward. It's very, very important that you're cautious about what you're saying to people on the phone when you call to inquire about these ads. I participated in a meeting last week where someone shared that all these television ads that we're seeing about health insurance that have a phone number for you to call, when seniors are calling those phone numbers, they are getting information about the product, and the telemarketer may ask them, would you like to speak to someone to learn more? And if the person says yes, they are then transferred to a licensed insurance agent to speak with. In doing so, most of the time you can only enroll in, say, a Medicare Advantage product at certain times of the year. When that telemarketer transfers you to that licensed agent, that is treated as what is called an incoming call. And sometimes the agent can enroll you based on that information. So you want to be very cautious about what actions you're taking over the phone with an agent you've never met. It's probably a good idea that you find someone locally that you can talk to face to kind of protect yourself. Here's another one. You get your bank statement in the mail, and you sit down to balance your checkbook, or at least you should be doing that. And you see a charge for Big Larry's Stereo Shop, but you've never been to Big Larry's. What do? You're going to report it to the bank immediately. You don't want to mess with that. Somebody's got your bank account number, and you don't want to lose any more money. So let's say you get your Medicare summary notice in the mail, and you sit down to review it, and you see charges for COVID-19 test kits. And you didn't request any COVID-19 test kits. In fact, you've got a whole cabinet full of those. What are you going to do? You're going to report it to Medicare immediately, or at least we hope you're going to, because in doing so, Medicare can stop those charges from being processed. They won't get paid anymore, and hopefully that's going to stop that scam. If nothing, at the very least, it's going to make them aware that whatever entity it was that's listed on your Medicare summary notice is fake. They shouldn't be sending you that information. Now, something that you want to keep in mind is most of the time, if you're getting a Medicare summary notice, and those are going to come out quarterly on paper. So it might be up to 3 months before you actually see some charges that might not be accurate. If you would like, you can get onto Medicare.gov and sign up for a Medicare.gov account. And you can start getting your Medicare summary notices electronically on a monthly basis. So you're going to be able to review that information much more rapidly. So it's certainly something to consider. It also saves paper. So think about that. And if that's something that would work for you, by all means, take advantage of that. The other thing to keep in mind is Medicare Advantage plans. If you're on a Medicare Advantage plan, they offer that same option. In fact, some of them already are doing it on a monthly basis. All right, our next scenario, your wallet gets stolen. Later, someone finds it in the trash, but the credit cards are missing. What are you going to do? Well, you're going to report the cards as stolen. You're going to cancel those cards because you don't want somebody using your credit cards or stealing your identity using those credit cards and stuff. By reporting the cards stolen, you're no longer responsible for the damage. Okay, our next scenario, your wallet gets stolen. Later, someone finds it in the trash, but the credit cards are missing. Thank goodness your Medicare card is still in there. A month later, you notice false charges on your MSN, your Medicare summary notice. What do? You're going to report those false charges to Medicare. Again, that's going to protect you. You're telling them, that's not my charges. I didn't have that surgery. I didn't get that wheelchair, whatever it is. Once you report that potential fraud, Medicare can actually issue you a new Medicare number. So your Medicare account is protected. The things that we stress in the Senior Medicare Patrol program are protect, detect, and report. We want you to protect your Medicare card. Treat it just like any other credit card. Think about it. Your credit card is limited by the amount of credit you've got available to you through that credit card company. Your Medicare card does not have that limit. Think about it. We just said that there were $60 billion lost every year. So fraudsters like Medicare cards because there's a lot of money out there to be gotten. Watch out for identity theft. Pay attention to things that you're getting in the mail. Pay attention to who you're talking to on the phone. Don't be giving out too much information. If you start getting things that in the mail that would indicate that someone has somehow gotten your information and is using it to, receive health care or something like that, you need to pay attention to that. The other thing to keep in mind, Medicare does not call or visit you to sell you anything. That is just simply not going to happen. The scenario I mentioned before about the plastic cards, that's actually happened quite frequently with Medicare beneficiaries. When you think about it, a lot of people have said, why in the world do we have these flimsy paper cards? I don't know why, but the bottom line is Medicare has not gone to using plastic cards. And if and when they ever did do that, I'm sure we would hear a lot about it through the news or in the mail from Medicare. Don't fall for those things. If you do get that that pitch from somebody and you just don't know, and they make it sound really believable, call 1-800-MEDICARE and talk to the experts. Do not give these people your Medicare number, your date of birth, or any other personal information. Beware of any free medical services. If you're out at the mall or you are somewhere and someone is offering you a free COVID test or blood sugar or something like this, and all they need is your Medicare number, don't give it to them. The only reason why they need your Medicare number is to file with Medicare to get paid. Don't give it your Medicare number except to your doctor or other medical provider that they've referred you to. Nobody else needs it. And they tell you don't carry your Medicare card unless you know that you're going to need it to receive medical care. If you're in an emergency or something like that, they're going to take you to the hospital. They're going to get you medical services, and then you can give them the Medicare number later. It's just another good way to protect that number. Now, in terms of detecting Medicare fraud, again, we want you to review your Medicare summary notice or your explanation of benefits for your Medicare Advantage plan or your Part D drug plan and look for any inconsistencies. Look for anything, services you didn't receive, or if you see something that was charged twice, services your doctor did not order, or maybe if your provider, maybe it's a provider you've seen before, but you don't recall going to them on that particular date. So to help you keep track of these charges, we've created these healthcare journals. These are free. You can contact our office at 1-800-763-2828 and request one of these healthcare journals. We'd be happy to send them to you. This is a document, it's a booklet, actually, that you can record your health history, your allergies, all of that kind of information. But you can also record your doctor's visits, when you were in the hospital and for what dates and for what reasons and stuff. So it makes it easier for you to go back and review your Medicare summary notice or your explanation of benefits to see if it's accurate. So the last thing we want you to do is if you do see something, we want you to report it. The first step would be to call, let's say it's a provider that you do see from time to time, but something doesn't look right. You don't remember that service or you don't remember going to that provider on that day. Call the provider's office and ask them, hey, I don't remember being there, or I don't remember getting an EKG or whatever it's showing on there. A lot of the money that is lost from the Medicare system is due to honest mistakes. And if they're reported, they can be corrected. So please, by all means, call a provider if you think it might be an honest mistake. Gather the information, gather documentation. If you still feel like it might be fraud, what we want you to do is give us a call. It's free, it's confidential. What we do is we gather, we want you to get your bills and any other documentation you've got. We'll get copies of that information, and then we can forward it on, as I said, to the Administration for Community Living. The folks there can review it, and if needed, they'll refer it on to the Office of the Inspector General. We'll also help you in terms of directing you who else you might need to contact. Do you need to call Medicare to report a stolen card? Do we need to get in touch with some other entity? Maybe you've got a Medicare supplement plan that we want to alert also to the possibility of fraud. So we can help you with some of those steps and help you stay safe. I told you earlier that we contract with a number of agencies around the state that provide some of the same services that we do. This is a list of the agencies with whom we contract across Oklahoma to work with us on the Senior Medicare Patrol. So looking at this list, you can identify your county. There's the name of the agency itself and the phone number where you can reach those people. And if you don't see something on here immediately, or if you just want to call us, again, you can call us at 1-800-763-2828. We'd be happy to help you identify what agency you can contact. So now we can take some questions. We've got a few minutes. And so Find my
So it doesn't look like we have any questions right now.
Okay. Well, that's good. If you've got any questions, please feel free to type those into the chat. I want to remind you about the fraud event that's going to be going on. I wish there was some way to do this faster, but I don't really know how. So I'm sorry if I'm giving you a headache. But I want to go back to that slide if I can, because I'd much rather have that one sitting up here, there. I want to remind you about the Fraud Prevention Conference. This is a really great event. There's going to be lots of different agencies, the FBI, the Office of the Inspector General, the Attorney General's office. They're all going to be there. They're going to have a booth all 3 days. They can answer your questions. I don't quote me on this. I think Social Security is also going to have a booth there. So please take advantage of this opportunity. Come and learn what you can. We're going to have a lot of rubber ducks. You see the rubber duck on here, folks? That's kind of become our mascot for these events. So don't miss your opportunity to get a duck. So, okay, have we got any questions, Rachel?
No questions, so it looks like we're good.
Okay, in that case, I will tell you guys, have a good day. Again, I hope you are staying dry and that you're not getting hit by this bad weather. And I look forward to seeing you next month. Now, I forgot, next month, our topic is Medicare appeals. So please join us for that topic. It's a lot of good information because a lot of people don't know they have up to 5 levels of appeals. They don't have to accept no. So please join us for that topic. And until then, have a good week.